Hello, my name is Riley Hammond, and this will be my lab demonstration for intramuscular injection. I'll be doing a deltoid injection today. So I'm going to come in and I'm going to have a look at the med cart. I'm going to grab a clean cloth and give it a wipe, making sure that it's clean and neat and tidy. I've got a good working space. I'm going to go ahead and hand sanitize, so applying liberally and working it in. That's good. And then at this point, I'm going to go ahead and address the MAR. I'm looking and I see Joe Milton, okay, and that's who we're interested in at this point. So I see that he's got a PRN for haloperidol, Haldol, 2.5 mgs intramuscular, Q 4 to 8 hours PRN, but not to exceed 20 mgs per day. So I've had a conversation with Mr. Milton. He's feeling a bit agitated today. He would like a PRN, so we're going to go ahead and pursue that. So I'm going to take a look, and I pull out my vial of Haldol. This would be my first check. I'm going to confirm with the MAR. So haloperidol, 5 mgs per ml. Okay, that's different than what the MAR says. The MAR says 2.5 mgs. So I know I'm going to have to do a med calculation at some point here. Good, so the first check is done. So I'm going to just go ahead and set that off to the side. At this point, I want to prepare all of my materials. So I'm going to go ahead and I'm going to grab both my syringe, which would be in a package. It would be sterile and neat and tidy. I'm going to go ahead and grab my needle, which today we're using a 25 gauge, 5/8. So we want to use between 22 gauge and 25, and no less than 5/8, maybe preferably an inch, depending on the muscle group. So we've got that there. I've got an alcohol swab that I can use to wipe off the top of the vial. And at this point then I want to go ahead and go through the 10 rights. So again, we've already identified that Joe Milton is our right patient. Joe Milton has the right to refuse the medication. He's got the right to education for that medication, and we've already addressed the right reason. We know that Mr. Milton is having a rough day, so we're going to go ahead and pursue that. So we've got the right medication, again, haloperidol, 5 mgs per ml. We've got the right time and frequency. So again, I'm looking at the MAR and I see here that I haven't given, or no one's given an injection in the last 4 to 8 hours, so we're clear to do that. We've got the right dose, and again, so I'm going to use a medication calculation. So if I've got 5 mgs per ml and I need 2.5 mgs, then I need 0.5 mLs of medication. So my calculation is done, my dose that is correct. And finally then I know that I'm going to be using intramuscular injection as my route of administration. Finally, after giving the medication, we want to provide the right to evaluation and assessment, making sure that there's no interactions, that kind of thing. And then we're going to go ahead and document at the end to finish. So the 10 rights out of the way, we can go ahead then and begin to prepare drawing up the medication. So at this point, I want to go ahead and withdraw. First, I want to pop the cap off of my vial. Okay, I'm going to take the alcohol swab, setting it on top, giving it a little wipe here, making sure that it's clean. That's good, and I'm going to just go ahead and leave that there for now. Okay, and then at this point, I want to remove my syringe, maintaining sterility, ensuring that it's not getting dirty. And then I'm going to go ahead and grab the needle package, open it up, revealing just the tip, taking that syringe, screwing it on nice. There we go, and I'm going to go ahead and remove at this point. Okay, so from here I just want to plunge to make sure that my syringe has got some good action, and I just blew. There we go. Okay, so we've got that movement that we need, good. And from here I want to go ahead and grab about 0.5 milliliters of air to displace back what I'm going to remove from the vial. Okay, so at this point then, I'm going to go ahead and do a second check before I withdraw. So I take my vial, I give it a bit of a stir as well, rolling it between the hands here. And then I take a look again, yep, Haldol, 5 mgs per ml for Joe Milton. Okay, second check is done. So at this point then, I'm going to remove the cap. And again, I've got my 0.5 of air for displacement. So setting the needle in, good, okay. Plunging down, 0.5 in, nice. From here, I'm going to go ahead and invert, okay. And now, knowing that I need to draw back that 0.5, fighting a bit with air bubbles here. There we go, that's a little bit better. Good. Okay, so I've drawn just a little bit over just to compensate, and I want to go ahead and push back just that 0.5. Okay, you can see that there. So there's a little bit of air bubbles. We would make sure that those are out. I'm not going to fight with it too much right now. So I'm going to go ahead and tip this back, removing the needle, scooping the cap to ensure. There we go. So the needle is scooped. That's great. So at this point, I want to do my third check before I put the vial away. So again, Joe Milton, haloperidol, 5 mgs per ml. So I've got 0.5 of an ml. So I've got 2.5 mgs. I'm going to put this back. That is the third check. Okay, great. So my work at the med cart is mostly done. I want to gather my supplies for going to his room. So I grab a couple of alcohol swabs. I grab a set of gloves. I've got my needle, I've got my syringe, and I might cover that syringe so that when I go in there he's not seeing the bare syringe and needle in hand. And yeah, I maybe want to bring a Band-Aid with me as well in case something comes up. So we head over to his room, and before I enter, I give my hands a good alcohol sanitization here, wiping off. I apply my gloves, good. So I enter the room. Hi, Mr. Milton, how are you doing today? Any issues so far? No? Okay, so it's great. So I'm going to ask him, do you have a preference for which side of your, which deltoid you would prefer today? No, he doesn't have a preference. Okay, so I'm going to go ahead and use the right deltoid for ease of accessibility. So we're going to first address that we've got the right patient. So I ask him, what's your name? Joe Milton. What's your date of birth? He provides me with his date of birth. And then to confirm, I'm going to have a look at his wristband. And that will be the 3 kind of checks that I can do for Mr. Milton. And so with that in place, then I'm going to go ahead and begin to first feel for that acromion process at the point of the shoulder there, that's really bony, and then I'm going to go about 3 finger widths down. So at this point then I feel for here, using this method to kind of identify the point, taking the alcohol swab and then applying it there. I'll get him to hold that for me. Okay, so he holds that hypothetically here. So at this point then I remove the swab, but I'm going to take first off the cap of the needle. Okay, so using the Z-track method, I pull the skin taut, good, and then just letting him know, hey, Mr. Milton, I'm about to give you your injection here. So I go ahead, inserting the needle at 90-degree angle to the surface of the skin. Okay, now at this point, I release that Z-track, the skin buckles back around the needle, and at this point I want to aspirate, so I just pull back lightly. Okay, if there was no blood, then I know that I'm able to continue forward. So I slowly inject over the course of about 10 seconds. Okay, so process finishes here. I withdraw that needle at the same angle that I put it in. And then from here, the needle's empty. It goes directly into the sharps container. Okay, so I'm going to say that we've set it directly into the sharps. I've applied a cotton swab and asked him to put pressure there as I drew the needle out. That way he's got a little bit of pressure holding the blood in. And ask him if there's anything else that we can do for him today. Ask him about side effects, and if he's noticing anything, just to let us know, let me know. And from here then, I want to hand sanitize on my way out. I remove my gloves. All of my rubbish has been ditched. Mr. Milton's feeling fine. So I head back to the MAR, and I'm going to go ahead and do that final documentation. So I identify my point and my time, and I go ahead and sign off on that as well to know that the documentation has been done. At this point, the process is wrapped up. So yeah, thank you.